some of the people, they want to get things done, but they do not get the aesthetic treatment. The reason for that is they are very afraid because it's their face.
Mhm.
They don't know the injector, they don't know what they're going to get into, and the biggest fear is that what if it goes wrong?
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Sadiya Naseem here of Sadiya Clinic. Sadiya is a doctor of nursing practice and board-certified family nurse practitioner. She is also a national trainer for one of America's top aesthetic training companies. In this role, she trains physicians, nurse practitioners, and physician assistants in medical aesthetic standards of care. She is also a regional trainer for a world-renowned dermal filler manufacturer. Sadiya has been singled out by this company as one of the best aesthetic practitioners in the region and is their exclusive trainer. So Sadiya, welcome. Glad to have you on the show.
Thank you, Daniel. Glad to be here.
Okay, great, Sadiya. So let's just dive right into it. I'm just curious, how did you get interested in aesthetics?
So, Daniel, it's a long story. When I was growing up as a child, I was the ugly duckling in the family. I always thought that I need to improve on something. So I worked hard. I was a very good student. I tried to carry myself, better than the others. It was in my mind, I have to enhance some way. When I came to America, I think I very quickly, I knew what I wanted to do. So I got into the skincare, and from skincare, I was got into the nursing, and from nursing, I knew that I always wanted to do the highest level of. So the highest level was for me to just finish the doctorate, do the DNP. And after that, I got into injections. Again, the goal was how I can enhance one's own natural beauty. That's what led me into this.
Got it. So can you discuss some of the most popular treatments that your patients come to you for? And also, I'm curious, why do you think that those are the most popular treatments?
So the most popular treatments in my clinic is dermal fillers. And also now the PDO threads are getting very popular. And I believe the reason they are getting popular because of the, as the aging, as we are growing older and older, so gravity doesn't leave us alone. So we just want a little bit more enhancement, lifting, repositioning, or redraping of the skin. So people are getting into that. And I get this question a lot, that what can you do to lift my face? What can you do? And these are the people who are afraid of getting under the knife. I've just suggested them that, surgery may be an option for you, but I can quickly sense that they're not ready for surgery, people who I have consulted so far. So this is the main reason I think the PDO threads are getting more popular, because they do something. The only problem with the PDO threads is you really have to very carefully choose the client or choose a person, because not everyone is a good candidate for PDO threads. So there are some reservations about this procedure as well.
Okay, got it. Now, I think this is a perfect segue into my next question, as far as how would you explain to someone who doesn't quite know the difference, how do medical spa treatments differ from your traditional cosmetic surgery? You talked a little bit about that, but could you explain a little bit more for those who really don't know the difference between what a medical spa does and what a cosmetic or plastic surgeon does?
Okay, that's a very good question, actually. So first of all, I always think I am in a position where I am learning from the experts, and I call plastic surgeons who have gone through so much in their life. They have spent so much time in studying and getting better and getting to the point where they can surgically enhance the human body. So I think we cannot compete them, and there is no point competing with them. They are always ahead of us, and they will remain ahead of us. So they're so much better with the plastic surgery if someone is at a point where you see that, like the lifting would not be enough, because with the PDO thread, with the dermal filler, you would never get the result as you would get from the surgery, so like surgically. So it's very important that you inform your patient or your client honestly that this is not going to help you. So I would say that when it's needed, when there is a lot of sagging, when there is a lot of skin crepiness, and the tension is gone, and you can tell that at that time, I think it's very important that you let them know that plastic surgery or plastics will help you to get the treatment, to get the results you're looking for.
Okay,
I think,
got it.
yeah.
Okay, so thanks for explaining that. I think also you brought up another point as far as some people just aren't ready to go under the knife, or they're worried about going under the knife, or any type of complications. So I would assume that that's kind of the big reason why a lot of people prefer the medical spa treatments, because they can get a result that is similar, and maybe in some cases maybe even better, but they don't have that very invasive part of the procedure. Would you say that that's very accurate for a lot of the patients that come to you?
Absolutely, that is very that is very like the important point. And the main thing is, people, when they ask about the different procedures I offer, they ask what's the downtime. So downtime is one of the things that are very important for them, because these people, they work. Taking time off from work is sometimes not very feasible for everyone. They have small children, some have like the jobs, even if they are working from home, but they are on the Zoom. So downtime is the main thing. Like, for example, small procedure, microneedling, people are not very open to that, or sometimes they have to find ways, so in the next 2 days they are off, so that they are not in the public with the red puffy, swollen face. So and I have worked with the plastic surgery. I have seen post surgical facelift patients. It takes a while, but not to say anything negative. Yes, you have gone through something, but you get beautiful results at the end.
Okay.
That is true. Yeah.
Okay, that's good to know. Now, are there any new or emerging treatments that you're particularly excited about?
So I'm very excited about the exosomes for the skin refinement, rejuvenation. I'm always excited about mostly non-invasive treatment, and the treatment that everyone can enjoy, that they are not, like super expensive, and then people have some reservations for trying that. I'm always excited for those treatment. And one of the treatment is like, now this is getting like in the mainstay, coming on the mainstay, this is exosome Surt Pry. I recently started doing aqua gold, and that also uses a lot of serums, and you make a protocol based on one's needs, what the skin type is, what kind of results they are looking for. Are the pores are very enlarged, or they are their skin is very dry, or it's acne based, they have scars. So you tailor the treatment according to their needs. And I feel like that is very exciting, like to recognizing the need, to diagnosing it right, and then coming up with that. And when you see the results, it's exciting. So for me, as like, I enjoy these more non-invasive kind of treatments.
Got it. Okay. Now, Sadiya, when it comes to, I want to talk about how you differentiate your practice from others in the industry. Now, in your introduction, you've been a trainer, you've been one of the top trainers in your area for fillers, for Botox, for things like that. So aside from that being one of your big differentiators, like you're the master teaching other people, what would you say are some other big differentiators in your practice?
For me, number one, there are a few differences I can tell you. So number one, I would say, is I'm always thinking that I don't know anything. and I need to work on it. I need to work. I need to get, improve. And I'm always trying to reading the latest paper, the latest study, research, or and I have so many mentors I follow, and always learning. That keeps me always like very updated. And when you are learning from the experts, they have done some research. They know that this was our last year technique for giving, for example, neurotoxin. I can give you an example. Like we were taught that to our corrugator supercilii, our muscle is right here, and we were doing over here. Thanks to Professor Sebastian Cortofana, and then we found out, no, we have to deal with the depressor muscle. So if I was not doing this, I would have gone or just continue to practice my old ways. So for me to change so quickly and learning what's coming in our way, I am moving with the practice. I'm in the aesthetic. I am moving with that. So that's what makes me feel very good, and that what makes me separate from the other practices, where when I go and train people and I see they think that they know all, and that's what they are doing. And when you try to improve them, sometimes people will say, oh no, that's how I've learned, or that's what I was taught. That is a little bit. You have to have a very open mind, and you have to keep moving as the industry is moving. You have to go with the flow.
You gotta always keep learning, always keep an open mind.
Always keep learning, always trying to be the best, and always thinking that there is someone who's better than you, and try to find out and then learn from them.
Okay. Now, in that vein of always having that education and learning, how do you approach educating your patients about the services you offer and the benefits of it? I'm sure you get some people that are maybe brand new to it or brand new to a service, and they're just not quite sure what to expect. Maybe they're a bit nervous. So how do you approach educating your patients about this?
Yeah. Sometimes it becomes difficult when you are dealing with a new patient and they don't know a lot about. And if you start teaching them, it feels like you're just trying to impress them. But I have noticed that people are very smart these days. They know what they're getting into. They research before they come to you. They read about the product. They ask you right questions. And I teach them through their questions. And that is way easier to, tell them. Like, for example, yesterday somebody asked me why you are using Jeuveau. It's a neurotoxin. Why not Botox? And I was like, I have Botox if you prefer, but let me tell you why I'm using that. So I explained to her, and she learned, and she said, oh, I didn't know that. Thank you. So that was very interesting.
Yeah.
Rather than I'm saying that, I'm using because it's available in the market. So it is available in the market. That is the truth. But at the same time, like, you just tell them what made me buy Jeuveau to offer to someone. So, and what is the difference between Botox, Jeuveau, Zeman, or Daxxify, or something? So that's how people learn, and they appreciate that. I've noticed my patients, they appreciate a lot when I tell them something about the product, and why I'm using, and why I'm doing it this way, my procedure. One patient asked me, last time, like 3 months ago, you gave me, a little bit different technique. So I told her, I said, I'm always learning new techniques, and I'm trying that. So we'll see it will be a good result. It won't give you anything negative, but we'll see. And she likes that. She said, oh yeah, I know about you. You're always doing something different. So
yeah, I think that's amazing. And I think that's one thing that's really missing in the industry. It's actually explaining why you're doing one thing or another, or at least you have a good reason to do it. It's almost like a consultative approach to it. It's not just, oh, I want Botox, I want Juvederm, I want this, I want that. Okay, I'll give it to you. It's no, like, this is a better option for you because of X, Y, and Z. So it's you're willing to, in a sense, go against what they want, because you're giving them a better option. You know this
Yeah.
is a better option for them.
Yeah, I'm very glad, just with this note, that most of the manufacturing company, including Allergan, Revance, and Prolenium, all these big companies, they are trying so hard to educate us, their consumers, and through us, indirectly, they're actually educating the public out there. It's working as a community, which I'm loving it, because every other day we get the email, there is a new training, and I don't miss any, whether it comes from Allergan, whether it comes from Prolenium or whoever. But these manufacturing companies are doing a lot, which is amazing, and I appreciate this a lot, because I feel like they're also realizing that this will grow, this field, which is growing like an ivy or a wildfire. But I think the intention is that it should grow in the right direction. Like, people are educated, the providers, they know the best skill set, how they can avoid or prevent harm to the patient, and also how the public is educated about this. So I think it is amazing. It's amazing.
Okay. Now, even with all this education out there, there's always going to be misconceptions. So what would you say are some of the most common misconceptions you get from your patients about the treatments that you're providing?
So there are a lot of misconceptions. I can give you an example, that patients sometimes think if we are giving them a little bit more units, because neurotoxin is given as units. So if we are giving them more, they will think that like more poison is going in the body, because it is considered as. So you have to explain, no. If you need it, you will get whatever you needed, you will get in that amount. The other misconception, which I handle quite a bit, that if I stop using neurotoxin, then I will have more wrinkles. So I explain it to them, the concept, when we exercise, we use our muscles, we build them. If we stop exercising, we lose our muscles. So when you don't use it, you lose it. So it's the same concept, that you every 3 to 4 months you're getting your neurotoxin and your muscle stays relaxed, so you're not using it, so you're kind of losing its aggressiveness or its movement. So you will need less and less. You will have the same amount of movement once you stop using it, but that will not make you have more wrinkles. So there are quite a few misconceptions, and about the dermal fillers as well. Like, if I use other than Juvederm, because Allergan, people are more aware of the name Allergan and Juvederm fillers, they think the other fillers are not as good as Juvederm. So then you go through, you tell them what is the difference, how it is manufactured, what is the technology. Sometimes they do understand and they appreciate that.
Okay. Now, with that in mind, how do you balance providing that relaxing experience for your patients while also ensuring their safety and well-being during the treatment?
Okay, so that is very interesting. Yes. You relax them by educating them, by telling them the procedure. Like, for example, even when I go from their left side to their right side, I always inform them, okay, I'm going to touching your right side of your forehead. I'm doing your glabella. I just keep them informed constantly. And I get that compliment from the patient that I like that how you walk us through. So that makes them very comfortable, number one. Number two is, there are another type of patients that they have a phobia with the needles. Those patients are more difficult to keep them calm. But if someone has a little bit of reservation because of the treatment, they're not sure, that is, you just walk them through and you just explain everything. That really helps them.
Okay, that's good to know.
Yeah.
Now, when it comes to medicine, a lot of people think that, oh, it's very scientific. There's the step-by-step path that goes into it. But what would you say, what role does creativity play in your approach to how you do these treatments for your patients?
Yeah, you have asked, this is my favorite question. Not that this question was asked to me before, but I'll tell you why. Because I'm a trainer, I train. When I go and I start my class, after my introduction or getting my students or participants introduction, we always talk about like how this field is evolving and what it entails. This is part of the conversation. I will tell them, you have to embrace the science. I 100% believe this is science, because I did not know. There was one point back in 2015 when I started, the beginning of 2015, or it was the ending of 2014 when I started. At one point, I gave somebody, like eyelid droop, eyelid ptosis, which everyone is scared of. I became so discouraged, and I started thinking whether this for me, or I should get out of this, or what should I do? Whatever I learned, I applied, and the result was so bad. So harming a patient or making the patient upset was so hard on me. I cannot even explain you in words. So what I did is, I don't know how it got into me. I watched something, or I don't even remember, but I started reading. I started finding the studies. I started like looking into it, listening to experts, their podcasts, their interviews, and their techniques. I spent a lot of money in learning all that. And I started realizing it is a science. It is a science. You cannot separate the science and the art. Once you know the science, once it's so in you that you feel like it's in your blood, then your art comes out. That's what I have seen and experienced with that. Like when you know the science so well that, okay, that's how it works. And if you do this, that it can go to north or it can go to south, it can create a problem. When you're so comfortable with that, your art comes out. Like, yes, art and science, they are together.
Okay,
You cannot say that they are separate.
That's a beautiful way of putting it.
Thank you.
Now, I'm really curious, Sadiya, when it comes to, I'm sure you've had some very challenging cases come into your practice. So would you mind just sharing maybe one or two stories of just a really tough case that came in, maybe someone that went to a lot of other places and couldn't get it resolved, but they came to you and you were able to get them just an amazing result?
Yes, I can. There are some stories which are very rewarding at the end. And I would love to share with you. I can tell you, not too long ago, I took care of someone. She came and she was very frustrated. She said, "You're my third injector. I have switched 2 injectors in the past, and you are my third one, so do not disappoint me." So I was like, okay, and what can I do? I got a little nervous. Oh my God, there's a pressure on me. So she said, I have tried even before that, these 2 injectors. I've tried to work on my gummy smile, but every time I got it done, they made it worse. So I said, okay. So I know I can fix your gummy smile. I can try. But then the minute I said, I know I can fix your smile, she got very upset with me. She said, everyone, you are just like them. Everyone say the same thing. I've heard this many times, and no, I don't know. So I have changed my mind. So I don't know. I don't think so I can, let you, allow you to get it done. So I said, okay, that's fine. And if you want neurotoxin on your forehead, we can do that, and we can leave your gummy smile. If you don't feel comfortable, that's perfectly fine with me. So while I started doing that, the way I do it, again, I have mentors, and I follow I love this technique. It's called 1-to-1 technique, and that was created or developed by a Brazilian dermatologist, and it's a beautiful technique. So while I was doing, and even though this is my 9th year of doing aesthetic, but I still like to draw so that I give the most consistent outcomes to all my patients. So I was drawing and I was doing. She said, "Why are you doing this?" And I said, "Because that's how I do it, and I will give you a very symmetrical result. And this keeps me stay away from the area where I don't want toxin to migrate." So she said, "Okay, all right." So while we were doing it, whatever helped her, she asked me, "Okay, why don't you do my gummy smile?" So I did her gummy smile. 2 weeks later, she sent me her smiling, selfie with a smile, beautiful smile. And she said, "You got me. You got me. I am there for you now." So I said, "Okay." So that was very rewarding, very rewarding. I just like, okay, it was a challenge because even I got like, what can I do? What if I make her more upset?
Yeah.
And she just stopped getting that because, like people don't know.
Yeah, I think that's an amazing story. It's always like that. We're like, oh, there's like a lot of resistance. They don't want to do it, but after they
Yeah.
do it, they're just so happy. So that's a fantastic story that you shared. Now, Sadiya, what do you think the future of aesthetics is going?
It's going very fast. It's a lot of lot of changes that we have to. I sometimes think it's getting hard to keep up with, but I think what will help us if we go with the flow, so that we are also changing. As the aesthetic is changing, we are also changing and learning new techniques. More and more energy-based devices are being used ever. It's like more and more. Now people are starting to do like, okay, less dermal fillers, more energy-based devices to give you beautiful result. Skin rejuvenation is coming into way, into the market. I almost like 2 to 3 weeks ago, I went to Cartagena, Colombia, to attend IMCAS conference. It's a world's plastic and dermatology conference where they don't actually invite nurse practitioners, but somehow I said, I am going to learn and I am coming. So and I did my ultrasound course there, and I also met a lot of nice people over there, and learned so much. And I was so amazed that how much it has changed since the time when I started doing it. Because again, so many new techniques of doing even the same procedures with the I would say with the dermal fillers, but there are new way of introducing that, or bringing some bringing very nice results with that. So it's changing a lot, and we have to keep doing what we have to do, just keep learning and moving with the changes.
Okay, fantastic. Now, Sadiya, I have one last question for you, but before I ask it, I want to point people to your website at www.sadiyaclinic.com. Now, last question is, what is the most important piece of advice you can give to somebody who's maybe on the fence about getting something done aesthetically, but there's something holding them back? What piece of advice would you give to someone like that?
Yes, people are, some of the people, they want to get things done, but they do not get the aesthetic treatment. The reason for that is they are very afraid because it's their face. They don't know the injector, they don't know what they're going to get into, and the biggest fear is that what if it goes wrong? So I would say that it's very important for people who are seeking for aesthetic treatments that try to find out about the injector, reading maybe Google reviews, reading about them, going on their website, checking, or if they have some videos out, seeing their technique and listening from other people what their experience. I think that would be helpful. I have a patient that reached out to me, and she said, my husband, I've been asking him that, like to get the treatment done, but he has so much reservation. And this is a new patient. She doesn't know me that much. But she said, after meeting you, that I can try and tell him that. So I think it's also sometimes people who knows through someone, word of mouth helps. But the other way is just going out, reading about the treatment, then watching people how they do it, and listening other people's remarks or their experiences would be helpful for the people who really want to get their aesthetic treatment done, but they have some reservations.
Okay, got it. Well, thank you for sharing that and for sharing your expertise. Now, Sadiya, where can people contact you in your practice?
So they can call this number. This is our office number. It's 703-424-8434. And they can also leave a message or text on the same number, leave a message. And also they can email. My emails are on my website, so I can be very easily accessible. People sometimes they DM me on my Instagram, Sadiya Clinic Instagram. That's how sometimes I would say that it's more easier for me if I get the message through the cell phone. That's much more easier.
Okay, great. Well, thanks for being on the show and sharing your message.
Thank you. Thanks for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.